Okay, so what was your experience with your GP support?
Um, it was very positive, and what was important for me was to see a GP who knew me and that had known me for years. I don't know why that was important, but it was really important, and I did. And I saw Dr. Ian Radford in Truro, and he was actually absolutely great. And I think it's something that's important, really, to know that the GPs are there for all sorts of things. I mean, things that I actually hadn't realised, which when I was having chemotherapy, was that actually I needed, what was a good idea was to have a flu shot, a flu jab, because obviously if you're having chemotherapy, then you're open to a lot of infections. And one of the things about chemotherapy, I think, was that I was absolutely terrified of catching colds, almost to a very peculiar degree. And it actually made me feel a lot more closed off, because at times it was in the winter when I was having my chemotherapy, there were so many colds around and flus, and so many of my friends and family couldn't come and see me because they had a cold. Or, actually, that's what they said anyway. I mean, it could have been a reason for having an excuse not to see me. But no. They had colds. So every time they had a cough and stuff, I couldn't see them. But my GP, I think, going back to that, GP was very good. I mean, I had the support, practical support there. I actually filled a form in that they gave me, so that I actually I didn't have to pay for my medication, my prescriptions, which is actually a really important thing, because I hadn't known about this, and you do need a lot of prescription drugs and during this time. So that was great, and actually with the diagnosis of cancer, I hadn't realised I don't ever pay any more prescription charges. So they give you a form, and you get a white card, NHS card. So I think it was good in also work-wise, because I have a full-time career, and I had to have sick leave, and I worked my work, I worked for medical school. They were extremely sensitive and very, very good to my needs, treated me incredibly well. But I also had the formality side of things to work out. So my GP was great at signing me off when I needed to. But also, I think it was important that they also were there if I just had any concerns at all. I mean, I was lucky having a lot of support, and a lot of people, lots of friends and family support. But I felt that the role of the GP was really important, and I found that they were very very supportive. I also accessed from my GP, which I think is very important for me. I'm quite a practical person, and I wanted to know what I could do to make myself better and as well as possible. And they said that there was a Southwest counselling service, and you could actually, I actually had 6 appointments that I could go and see the counsellor. I've actually seen them 3 times now, and I'm sort of keeping the extra 3 for maybe the times, when I feel I need them. And that was actually, although I'm a very, very practical and positive person, it was really helpful, because there are an awful lot of situations where your concerns that we all have about cancer, will cancer come back, although, people say there's a good prognosis. I think it's important. Family and friends find that very hard to discuss, and there's certain areas that they don't want to discuss because they get too upset. So actually, I think the counselling was a very practical and positive, helpful thing for me. I think one of the things I probably said is that, and what's really important to me, is that everybody's experience of this disease, of cancer, of breast cancer, is just so different. And whether you might have the same type of cancer, the way that your body deals with it, and whatever happens, it just means that every single individual therapy is slightly different, and experience is slightly different. I think that's really important actually, because until you've got it, or until you've had that prognosis and you've been through that system, you don't realise that. You just think breast cancer and it's just one thing, but actually it's so many. So that's why I think it's very important that people don't think, well, just because this happened to that person, then it's going to happen to me. So, yeah. Well, it was actually a Sunday evening, and I noticed in the mirror that there was a skin abnormality, a type of tethering on my left breast, which instantly caused me to panic. With a healthcare background, I very, very quickly thought it's cancer, and I'm trying to think about how I acted, because it is a little bit of it's quite a big bit of a blur really. It's almost a dream type quality. This is only probably just about 12 months ago, so it was in July of last year, and I talked to my husband about it, who is nothing to do with the healthcare. He was very, very frightened. I didn't really talk to anybody else. My daughter, I didn't want to talk to anybody else until although I was sure in my mind. And then I phoned up the GP surgery the next morning, sort of just as soon as they were open. And I can remember crying on the phone to the receptionist. And they were lovely actually. And they got me in to see a locum GP just within 10 minutes of the practice opening. So I went on my own, and thinking about it, probably it would have been a good idea to take somebody with me, but I didn't really think about it. And it was a locum GP who sort of just looked at me, examined me, very kind. She was very kind, and then she just gave me a look, and I realised in that look that it was, that was the likely diagnosis of cancer, really, from that look. And I do remember coming out and sitting outside the GP surgery on my own, on a bench, and sobbing. And then, strangely enough, I decided that I would treat it as an ordinary day and catch the bus into work. So, on the way in, I can remember being on the bus in tears, and I can remember phoning up two of my good friends and talking to them, and meeting one of them at work. Don't remember very much more about that, apart from that my GP had said I had to go within 2 weeks to the one-stop clinic. So when I came home, I told my family, I told my daughter, which was the hardest thing of all. I can remember telling her and being scared that she might walk in front of a car, because she was in the town when I told her. She was on her way up to see me, but she could tell something was wrong with me. And my husband was just very, very pale and very frightened. My auntie, who was really being like a mum, I suppose, to me, was very, very close. So I think that was probably, there was a great deal of shock thinking about it. I knew though, I knew even before the investigations. And then when I went to the one-stop clinic, I had a very close friend came with me, which I'm so glad I did, because although maybe the investigations can take up to 4 hours, you have lots of waiting quite often in between. So actually it was a whole day that we were there, and we actually caught the bus down for lunch in between it. There were some procedures there, the needle biopsy and the core biopsy mammogram, and I felt that the people were very competent. And although I was part of the NHS for a long time, I actually felt comfortable being there. They all were very kind, and they all seemed to know what they were doing, which made me feel very good. But the surgeon um, Professor Drew was absolutely fantastic. He, the core biopsy or the needle biopsy um, was they weren't able to give me the result even though we were waiting, and sometimes that does happen, and that's because sometimes there are others there were, there's traumatic, and sometimes there's blood in the cell. So, but as he said, it was pretty obvious to him what it was, even without the that final bit. But obviously, the one bit he did tell me, in fact, the breast care nurses told me, who were also incredibly supportive all the way through, not just at the beginning. They told me that all the information I'd get would be by little bits at a time, and actually that would be really difficult. And I think, I think it was difficult actually. It was helpful as well because I don't think I could cope with very much each time, although I sort of knew the medical words and what was going on. There was an element of disbelief, I think, and shock, which meant that I didn't take in lots of things. Another reason why I was very lucky to have somebody very good with me at the one stop for the whole day, because she remembered things that were said, and I remember them said completely differently. So I think that was very good. How did I act? Looking back, I think it's quite funny how I acted, but I'm quite a practical person, and I think because I couldn't control a lot of things like the results coming back and what they would say, and then surgery, and then would I need chemotherapy, all those sorts of things. I had to do something really practical. So much to my close friends and families, I think probably a little bit of amusement, but they were a little bit concerned, I think. I decided to make an appointment to make sure my will was in order and that my funeral would be sorted, and also that my mortgage was running online with a dodgy endowment. So actually, looking back, I think they just let me go doing it because I think they thought, well, it's not going to hurt her. And I was doing something. I was actually doing something, and I was connecting in that way. I was still going to work, and I don't know why I was doing that really, because I don't think probably I was a great deal of help to anybody, but they were great as well because they just let me keep coming to work. But yes, I mean, I think organising my will, I wouldn't recommend, now I look back, I think it's quite funny that here I am 12 months later, feeling well, and at the time I was so frightened. I almost felt that it could be, I wouldn't see people, or my life might end in a matter of days or weeks, which is an odd thing.